Today's report warns that obesity in the UK is now more frequent, more severe, and is occurring at younger ages than was thought possible even 5 years ago.
Young people who smoke cannabis regularly run the risk of irreversible damage to their IQ, according to one of the largest studies ever carried out.
There's been a 68% rise in hospital admissions as a result of self-harming in the last decade, and 1 in 12 young people in the UK now self-harm.
What do you think of 13-year-olds having sex anyway? No, I'd advise that they don't.
This year's report shows that a hardcore of youngsters are drinking to excess, with 4% of children as young as 12 consuming the equivalent of 19 glasses of wine a week.
Health issues regarding young people have led to some emotive headlines and press coverage, but we very rarely hear the views of the young people themselves. What do they think are the health issues that affect them? Are there any services to provide help and support, and if so, do they meet the needs of the young people?
For me, health means maintaining a healthy diet, which, obviously involves what you hear, like all the generic stuff, like having 5 a day and stuff like that. But then there's having that in balance with, like, fitness and keeping actually physically fit, because I don't think you can be classed as healthy if you eat, like everything that's recommended if you don't keep fit at the same time. I think the two go hand in hand.
To me, health means feeling good and being happy and being comfortable, I guess.
Just like, looking after yourself, eating healthily, going to the gym, just making sure that you're healthy and fit.
Health is basically your lifestyle. You've got to have a healthy lifestyle emotionally, physically and mentally, I think.
Health to me means trying to keep yourself as fit as possible mentally, physically, psychologically, and not having many issues to deal with, really.
Health, well, you got mental health and physical health. Mental health is the how mentally happy you are, really, and physical health is how fit your body is. So if you're ill or sick, then your body is not up to the peak potential that it could be. And if you're mentally ill, you're in a depressed state of mind, basically.
Mental state of mind and
good well-being.
Like, if you're in good health, then you're fit and stuff like that. Like, you're not ill all the time. Whereas if you're in bad health, you're gonna get ill. Like, your immune system's really bad and stuff like that.
Probably mental health. I know a lot of people that I hang around with, they all suffer from something to do with mental health. Like, some of them think they have depression. They may or may not have, obviously. A lot of them self-inflict pain and things like that. And I think that's one of the biggest problems with the people I hang around with. Not a lot of them access enough help at all, and it leads on to other things until it gets to a problem that progresses.
Young people go out having stress with exams and going out getting drunk, which can lead to one-night stands and STDs and STIs, or it can lead to going on to drugs and drug addiction as well.
Mental and physical state. Because some young people out there like self-harming and stuff.
They feel like they can't talk to anybody about it.
When they can.
I think obesity, to be honest, because junk food is really cheap. So yeah, people can get scranning on really cheap, fattening things.
I think smoking's the main issue because there is most shops that sell cigarettes to young people, and you're not meant to smoke and that. So I don't smoke myself. So most people that I know smoke, and I can see how it's affecting them every day, and I just don't like it.
It's depression and mental health, it's just awful, crazy.
I think smoking and drugs and alcohol.
I think the main priority for young people at the moment would be health services, working within the schools, working with teachers, you know, ensuring that they have access to the various services that they need and require as and when, but also, you know, prevention, getting to change a child's lifestyle before it becomes a problem, before it has a knock-on effect on their health.
Like, the sexual health is really promoted nowadays. It is quite promoted, it's all around schools and things like that. I think that kind of makes it like things like mental health, which you don't see at schools at all, not very much at least. And you do see a lot of things where you can go talk to people about your sexual health, but there's very, very little on mental health states. There might be the odd school counsellor, but that's about it.
I don't know, I think it's just support with it is the main thing, really. Just like a service where you can ask whatever you want and not feel kind of pressurised by anything.
I think like sexual health, to be honest, because it's quite a big problem.
I don't really talk to anyone professional. Like, maybe if I went to the doctors about something and I might get a referral, but usually I just talk to a friend, somebody I knew, or my parents. My mum gives a lot of healthy information.
I'd speak to someone who knows about it, like one of the youth service members here, or go to the hospital or the walking centre, because they're the main two ones in town. They could probably direct you to the places that you could end up being.
Quite often in this generation, one of the first things they'll do is like type it into Google or something like that, or just look online. So that's probably quite a likely thing as well. So I think that there should definitely be more things like available online to do with health, like official things, not just typing into Google and then Yahoo Answers or anything like that.
To find out what's available, I'd go like the internet and ask my mum and that about stuff.
Probably the internet, and that's a not very good place to look at because it tells you that you have insomnia or schizophrenia.
I think it's actually pretty hard for a young person. It's really scary to go to a doctor and say, I've got this problem and this problem, when you're not too sure about it yourself. Like, I've been in that situation lots of times where I've been scared to go to a doctor about something that might be very serious, but it's the idea of it's someone professional and someone a lot older, and sometimes not all doctors and counsellors and people like that, they don't have the right approach at all.
To be honest, you feel a bit neglected because they don't take you seriously. Obviously, you're younger, and they think they know everything kind of thing. Like, they don't listen to you properly, they do things without asking you properly. Like, if you say no, then they'll go and then push it forwards. No, I'd say it was not very comfortable environment.
Not all of them. Some of them are. Those that are primarily aimed at young people, that's, you know, with doctors and nurses and all other kinds of healthcare practitioners, where their services are aimed at young people, they're very much young people friendly. Those services which have opening hours, especially for young people, may not be so much. Again, but that is just due to training or lack of experience of when working with young people.
It can be easy, but sometimes when you go into a GP, like, you're the only young person there, so it feels a bit awkward.
Some are friendly, some aren't so friendly in a way. Like, some people just not take you seriously because you're a child or a teenager, but some understand because they might have a child at home who's been through the same thing you're going through.
Stuff like your GP, in personal experience, I don't think they're very helpful. I think they're a bit sort of just want to get you out of the way and like see you for 5 minutes and then that's it. They don't really follow it up or anything like that.
They're just very plain and boring, like they're not very, you know, you just feel a bit uncomfortable as though you've done something wrong just if you're a bit ill. And that, you know, they just don't make it look nice.
I'm not quite sure because I'm not even sure how the system works, and I know you've got to follow certain guidelines to how you approach someone young. But I think on the mental health side, you should have more people that can speak from experience and not from a textbook, because most of the time, you know, well, in my experience, most of the time what she was saying to me wasn't very right.
Some of the young people in Darlington especially have no idea where to go for certain things, so if you could raise the awareness on that, it might help that.
It needs to be worded out easier, and it needs to be in a style and format that a young person can understand.
Get a child-only clinic or hospital or something like that, like between the range of like young, not like babies, but like from say 10 to about 19, so like teenagers.
Like if doctors could realise that teenagers, some of them do have actual problems, it will be really beneficial to most people.
It would help out people a lot more as well. If they're just open about it, you could just go through, even if they're not like, even if they're not sure, they could just go and grit your teeth and just make sure you're okay.
Some doctors put them off by the attitude they have because they're really the customers are kidding basically.
Like you know, some places have like drop-in services for different people that only like have a certain time that young people can just go in and not anyone else is allowed in that time.
I guess like going around to different schools and colleges and kind of explaining to young people the services that are there and how they can like get help if they have a health issue.
Just like make it a bit separate for like young people and then one for older people as well, so you know they don't feel as though it's not friendly for them, because then if they don't feel like they're comfortable in it, they won't go and then they won't get help with anything.